It's insane how much attention there was to it and the shortage. Pharmacies were authorized to start manufacturing hand sanitizer. That was bonkers. But I guess that was like almost a year ago now that all that was happening.
Alex, thank you for joining us on RelyLocal. Your Good Value Pharmacy is in Racine and Kenosha, and you're helping people all around. How many locations do you have now?
We have one in Racine and three in Kenosha.
Okay.
Yeah,
fantastic.
So it's actually 4 locations, but 5 pharmacies. We have 2 pharmacies in the same building in Kenosha because one of them does more of like the assisted living and group home business, and the other one does the medication packaging for people that live in their own homes.
Great.
So 5 pharmacies at 4 locations.
Oh, fantastic. So what got you into the pharmacy world? How did that get about?
My dad was a pharmacist. He was the original owner of Good Value Pharmacy.
Okay.
My whole life I've been around it. And around the year 2000, my dad bought Good Value Pharmacy. At the time, there was just one location in Kenosha on 80th Street. He was working for the owner as a pharmacy manager, and the owner wanted to get out of the business and move on to other things, so he sold it to my dad. And so we had a family business in pharmacy in Kenosha since 2000.
Fantastic.
And so obviously, I was in high school and was employed by the pharmacy and learned from an early age, how to fill the prescriptions and how to run the robotics and how to take care of customers, answer the phones.
Great.
And then I also did a couple summers as a delivery driver in college because we do delivery in southeastern Wisconsin as well. That was a good, relaxing summer job, just kind of driving around, get the Mountain Dew, and just deliver prescriptions to people, which was a good job.
So what I'm hearing is you were a drug dealer in high school.
Yes, exactly. Yeah, little did I know it would lead to me running the entire pharmacy now, but back then it was more just driving around and taking care of patients one by one. So
when you're young, you just don't know where you're going to be going.
Right? Yeah, exactly.
So you just hope that you have a good time doing it.
Yeah, so I went to college in Madison and started studying science and math, which I enjoyed and did well at, and decided that healthcare was right for me, and then pharmacy made sense and got into pharmacy school, and then a couple years later I graduated and then joined my dad with the family business. So
great.
That's kind of the path to where I'm at today. My dad's no longer with us, but
I'm sorry.
In 2015, he passed away and left the business to the family, and now I'm kind of running it. My brother's a pharmacist also.
He's
with the business, but he's in medical school. Phil's in medical school, he'll be a doctor in a couple years. He just works part-time for us as a pharmacist now.
Wow, fantastic. Oh, that's great to have all of that within the family.
Yeah, it's fun. 5 kids, 2 out of 5 went into pharmacy, so I think my dad thought that was a good percentage.
Yeah, that's great.
Well, that's very cool. What would you find is going on today? Obviously, there's a lot going on with the COVID world and all of the things crazy with that. What would you say is one of the biggest struggles you guys are having right now? Is there any?
Right now, in the last few weeks, it's been the significant drawback in how many people are looking for vaccines. In addition to that, we're not showing up on Google searches right now for some reason. So there's a website called the Vaccine Finder that is supposed to have an interface with Google so that people can find vaccines. For some reason, we are on Vaccine Finder, we've done everything that we're supposed to be on the website and be on the interface, but for some reason we're still not showing up on searches. So right now, we went from doing, about 1,500 vaccines a week, maybe a little bit less sometimes, but that was our peak. To now we're only doing about 50 new doses per week.
Interesting.
And part of that is because of the Google issue that I mentioned, but older people and even people that aren't millennials and Gen Z, they would call or just go right to our website if they've already heard of us. But the young people that are mostly getting vaccinated now, they're just going to Google, you know. And a lot of people just, you know, they search vaccine near me, and if you're not on those results, you're not gonna get appointments. So it's been a big shift from doing those high volume clinics and hiring people and getting all these things in place, and then there was just a point where it just dropped off. So now we're like, you know, figuring out other ways to, you know, use our people and
Well, we're happy to spread the word.
Yeah.
I think a lot of people are trying to figure out what they're doing with that. I'm sure you get a lot of questions.
Yeah, for sure. There's you know, for a while there, our phones were ringing off the hook and it was going crazy and all that stuff, and we still get a lot of questions about it. But it seems like now that 55 or 56% of adults are vaccinated, there is a significant portion of the population that is either hesitant or completely against getting vaccinated. It's definitely slowing down big time, and that's not only around here, but that's across the country. It's definitely peaked and it's going down significantly.
Sure.
And do you offer all 3 of the vaccines, or one's on hold, isn't it?
Well, one of them is actually the Johnson & Johnson. They reauthorized to start using it again, but it's I think people are really scared of that one.
Yep. I wanted it at first, and then
because it's a single shot, isn't it?
Yep. I was like, oh, one and done, I'll be good to go.
And it's women who were affected by the blood clot in your age group. Yeah. So So I mean, it was it was about 1 in a million people had it happen to them. So I think that's probably why the FDA was like, okay, we'll let people, because I mean you affect the supply, and all of a sudden then you have more COVID deaths theoretically, and so you know you lose some people there and you lose some people there. It's kind of like, was it really worth pausing? I don't think so, because then you have this stigma around around all the vaccines
in people's minds.
And I think it did more harm than good, especially since it was just a 2-week pause for them to look at the data. At the same time, you can never be too careful, and they had to do what they had to do. So.
Well, when everything was rushed with the testing and stuff, I think people are just being cautious. So I can understand the downturn, and then there's a big percentage of people that have already gotten them. So you do have all 3 of them available?
Oh yeah, to answer your question, we have Pfizer and Racine right now, and then Moderna in Kenosha. So we were doing mostly Pfizer for a while, and then the state switched just over to Moderna.
Are you guys going to be offering to the kids? Because I know this week they're supposed to
step up the kids
making it FDA approved for 12 and up.
Yeah. So as soon as we're authorized to give the vaccine, we're going to give it to anybody who wants to get it. So that's kind of our position is, if the FDA authorization gives us power to give the vaccine, and we have a patient that wants to get the vaccine, we're going to be giving it.
And I would assume, and I hope that you would get a good turnout once that gets off. You'll get a whole other influx of a group of people that can come in.
Yeah, I would think so. And the people at the state of Wisconsin are trying to work on the Google issue and get their contacts there. So, but I mean, in the big scheme of things, your question about the biggest challenge, it's not something that's going to really affect us a whole lot, but it is a frustrating thing that it's completely out of my control.
I was just going to say anything that's out of your control. Out of your control, it's like terrible that you have to battle with it. Something probably not a big deal, but it's just enough to affect
somebody didn't check a box or something.
Well, they can't figure out what it is. It's not. I don't think it's anything to do with SEO. It has to do with the interface with Vaccine Finder and Google. So they get their data from Vaccine Finder.
Interacting there. That's not proper. Oh, that's too bad that that's going like that.
That's all right, though. we were one of the early organizations in the area to get the vaccine, so I feel blessed and happy that we're able to be on the front end of things. I'd rather be on the front end than the tail end, I suppose.
There you go. Yeah. Absolutely. Do you know, I'm sure a lot of people have questions with the vaccine. I mean, you probably only know so much, but does it look like it's going to be a yearly thing, that people are going to have to get it every year like the flu shots? Or
I think because the data is so new, people just started getting vaccinated in January, so it's only been about 5 months since the first people got vaccinated. So it's going to take a long time to figure out how long these antibodies and the immunity last for. And I think I think after a year, we'll know
bigger picture
if it's going to be annual or not. If the antibodies are starting to wane in the people that got the vaccine early by the end of the year, then they might say, okay, it appears we have to start giving boosters, once a year. But
it's going to probably take a while, I'm sure.
And I think the other big factor is the the different variants that are coming out. Like they do with the flu shot, they kind of tweak it each year to make sure all the strains
there's
are covered.
There's like A, B, C, D, and they try to figure out which one's going to pop up first.
Yeah, exactly. So there's like a few different moving pieces here. There's the strains and trying to catch up or keep up with the evolution of the virus. And then there's also the antibodies from the original vaccine. How long are those going to last? So it's going to take some time to look at that data and figure that out.
Oh, that's an interesting point. Would you say with all of these crazy things going on with COVID that it might be helping people be more educated within their own health?
I think so.
Bringing people towards looking at better health for themselves. Do you find that?
I'd hope so. I think most of the attention's been on hygiene, hand hygiene and distancing and being
which is kind of crazy when you think about it.
Don't even get me started. When this all happened and everyone was like buying all the soap and hand sanitizer, I was like,
what have you been doing?
Not washing their hands?
Yeah, what have you been doing for the last 30 years?
This is how you wash your hands. I'm like, did we not? Do people not know this? I'm like, I've been touching
people
for years.
Were they sick in kindergarten for the whole time? Yeah,
it's insane how much attention there was to it and the shortage. Pharmacies were authorized to start manufacturing hand sanitizer. That was bonkers. But I guess that was like almost a year ago now that all that was happening.
Yeah. Right. But
yeah,
it's been a crazy year.
I think people should pay more attention to the more important aspects of health, in my opinion, which is how they're eating.
Yeah.
And I mean, obviously, drug and alcohol abuse, obesity, exercise. I think those are the most important things we can focus on. Has the COVID pandemic really put a spotlight on that? I don't think so. Maybe for some individuals, but I think from a high level, it's more on the hygiene than it is like the more important aspects of living a long, healthy life.
Right.
And I think that's more of the immediate, like, keep the germs off of me now rather than, how can I stay healthy for a longer period.
That's a great point because, in pharmacy, we kind of get a bad reputation for just selling drugs, right? We treat things once they happen, right? And so,
not as much preventative.
Right.
That's the word I was going to be bringing up. One of the
focuses that pharmacists actually do work on is primary prevention and preventing things from happening down the road and coaching people how to do the right things in their life to prevent those things. And there are also a lot of medications that are preventative and all that. So
there we go.
I like talking to my patients about that. We try to do the best we can to coach people, but I think it's very, very, very difficult because people are so short-sighted.
Oh, sure.
Generally speaking, of course, and I'm just as guilty, right? Like, if my wife asks me if I want to have dessert tonight, I'm probably going to say yes.
Yes, I want dessert right now.
Or cheesecake or something like that. It's like I'm not thinking about the impact of that years from now or maybe even next week when I step on the scale.
We're a very instant gratification type society.
We are. And I think it's a big problem. Everyone's guilty of it.
So it's just so easy.
It's
just so easy to eat, what you want, when you want, and all of a sudden it gets to be a problem.
And the most accessible and cheapest foods seem to be the fast food and processed canned food as well.
Sure.
And frozen foods.
I'm definitely guilty of that. I have a large family, and I'm so busy that it's like, oh my god, okay,
quick food,
drive through again, and I'm like, I feel so guilty doing it, but sometimes I'm just like, I just need to shove food in their mouths at this point. And,
sure.
And it's it's something I wish I didn't do, but it's something we all do. And
that preventative question is a good one, actually, though, because I think a lot of what you might have going on with the pharmacy could be playing a lot into that. Because people, well, you said it yourself. They're coming to you because they have an issue going on. How can somebody, do you think, can change that pathway for them? Is it more of their healthy eating? Is it the hygiene? What do you think really plays the biggest impact on that?
Well, I think regarding the COVID virus, I think hygiene and distancing and getting the vaccine and wearing a mask if you're close to people, especially people you're not around, is important. But as far as the other aspect of it, the long-term stuff, I think it's baby steps. Is someone going to all of a sudden start exercising 5 times a week and eating just vegetables and salmon and things like that?
Tomorrow,
probably not. Right. So I think you try to talk to the person about what they would like to do. People are only going to make changes if it's something that they want to do.
Makes sense. Makes sense.
So so you pick one thing. Maybe they're okay with walking around the block a couple times with their significant other.
You're right. The baby steps.
Yeah, or maybe they're okay with starting to introduce some more vegetables once a day, or even a couple times a week to their diet.
Right.
And I think if you can have a difference in someone's life like that, and they notice it, then they want to take a second baby step.
There we go.
Introduce something
They're
else.
starting to feel better,
life.
maybe.
Yeah.
Things are turning around. Yeah,
And
that
I think
makes
you
good
must
sense.
have a great opportunity that way, being a smaller, local pharmacy, to really get to know those people, so they're gonna trust you more than maybe just,
Good point.
I mean, I don't want to say any
Good point.
any of the big box
Right.
type pharmacies where it's like,
Yeah.
it's
Next.
maybe a different,
Next.
and
Next.
they
Yeah.
might remember if you go there real often, but I mean, there's 6 different pharmacists and things like that.
Good
And
point.
it's just
Right.
kind
Yeah,
of
good point.
assembly line kind of thing, and you don't get that kind of service when you're able to really know you. Hey, Alex, hey Joe, whatever, and they're gonna build that relationship with you and maybe actually take some of that advice from you, which is really
point.
cool. That's a different kind of thing than you would get at a big box kind of pharmacy. So
Yeah, and honestly, I mean, I've worked internships at the big boxes, and it's difficult to have those conversations with people because you have to close a transaction. You've got to move on to the next
got
thing,
6
or
more
else you
people
get
in
backed
line.
up.
Yeah,
So
how
it's
many,
like
how many people?
it's kind of the nature of the beast there. But you're right. We do have more time and are able to spend the time with people, and like you said, get to know them by name, and you drive past a big box and there's 8 cars lined up in the drive-through, and that's typically not how we are. We do enough business to do well and to stay in business and all that, but our focus will always be on the customer.
That's cool.
And earning loyalty.
Changes.
Once people come over to us, they typically don't leave because they notice a difference right away.
that's good to know.
That's really good to know.
Yeah, I mean the biggest challenge is getting those people in the door because if you're, let's say you're a 40-year-old person getting a prescription filled for the first time in a few years. What's the first pharmacy that comes to mind? Probably the huge building that's on your corner,
Right.
or the one that has national television ads. They just have that name. So,
Right.
so the biggest long-term challenge I think is really, getting people in the door, making sure people know that there's other options other than the chains. I will say another big challenge is mail order because. A lot of times the mail order pharmacies are owned by the insurance companies. So
interesting.
they can push people into their own pharmacies and offer them discounts if they get 90-day supply through the mail. So you have, let's say 85-year-old Nancy that wants to save $20 a month. She loves coming to your pharmacy.
Right.
She wishes she could stay and get the same price, but how can I tell her it's better to come to me when she can get her medication for $25 cheaper?
Yeah.
Right.
And that can be a challenge sometimes.
Right.
It's not always the case. A lot of times we
Sure.
are very competitive with pricing and all that. But
That's good.
sometimes the Amazons of the world and the big insurance owned mail order firms, they can pose a problem too, because I think people like the convenience of that at times too, of just getting in their mailbox. Then it sits there for 3 days, and then you got drugs in freezing cold weather, humidity, or really hot weather.
Right.
And then you call, and it's you're on hold for 20 minutes or whatever.
Yeah.
It's like
That personal service makes such a big difference. I think for me, it's just knowing that you're going to talk to a person and not have those automated things where you go through 6 different.
Yeah.
Press the right number. Oh, I just got booted back to this, and I get so frustrated. I'll yell at the computer.
It's life
sometimes.
draining. It's life draining.
Can't
Yeah,
stand
it's
it.
And is
just
it
terrible.
refreshing when you call a number and someone actually answers?
Yep,
the phone?
I almost get startled. I'm like,
Yeah.
oh, hello? Is this a person?
Yeah, you're a human
Yep.
being.
Yeah, it's kind of a refreshing thing, and that's why we've kind of stuck with that model at almost all of our pharmacies because I think people like that.
Yes,
Absolutely.
I agree.
think
I agree.
it's a lot of what's missing in our society now is that personal connection. Even though we have the social media and we have all those things where we try to feel connected, but it's not the same as talking to someone and going in and having that personal relationship. I think that it's something that we all really crave and need just as human beings. So I think it's really cool. Are you able to take all the same insurance and things like that? So if people have prescriptions, they could just come over to you and that you still cover with insurance?
Yeah, so I would say over 95% of people out there will be able to use our pharmacy.
Great. Wow.
Pretty much almost everybody. Some plans have restrictions or preferred pharmacies they want you to go to, but
Kind of like what you were talking about a minute ago.
Yeah, for the most part, we're open to anybody that wants to use us, and even people that don't have insurance. We have discount programs and things like that. We're very competitive.
Great.
With other pharmacies.
Okay.
And hardly ever do we get someone to come in and have to reject them for any reason. So,
Okay. Well, that's great. That's great to know. So.
Yeah, I think that's really important for people to know if they would like that more personal service. That hey, really
Right, there is that available.
It's not going to be like a problem to switch my insurance over there or anything like that.
Right.
I think people don't realize how easy it is just to call and be like, send my prescription over there.
Yeah.
Right.
You know?
Yeah, it is very. I think you're right about that. People get comfortable in their routine,
Convenience.
and they kind of think, oh, maybe I have to wait 45 minutes to an hour everywhere I go for a prescription, but that's not true. You don't have to do that everywhere you go.
Right.
You know, you don't have to sit behind 6 cars in a drive-through everywhere you go.
Right.
So I think it's good for people to kind of think about that, and it's good for me to think about that. Like, should I really be doing this? Is this the best thing for me? And then you can make a educated decision about the businesses that you're using and the choices that you're making.
No, I think that plays well. I think people really are looking for that.
Yeah.
Maybe that's why we have the show, Rely on Local. We're trying to get people to think about local things and working in that local way. And I think people want to do that. You just don't know how, when, and where to do it sometimes.
That's for sure. Yeah,
And
you have to be conscious about it too.
Yes.
You have to be conscious to make the decision that
Yes.
I'm going to shop local. I'm going to go to a business that has better service and find a business that has better service, and they're usually
they
local.
live here. They care about what's
Support
going
the
on
community.
here.
Yeah,
Yes.
that's what I was going to ask. Is there any community support or community stuff that you do like locally in your area with your business?
Yeah, so I think the biggest impact that we have, I think that people really notice, is our medication packaging program.
Okay.
And I think that has the biggest impact on the community. We've been doing it for a long time. And it sorts the pills and what people have to take.
Oh, okay. Organizes.
Yeah, organizes them and prints the date and the time of each dose on the packets.
Wow.
Kind of like you may have seen like Amazon's pill packets, similar to that.
Oh, okay.
But yeah, so
you do it like individual packs, so like AM, PM kind of thing, so people don't have to sit there and like feel like
Fuss
they're at a
with you.
pharmacy.
Yeah.
So
right.
it comes
I do
in
that every Sunday for my daughter. So yes.
It comes in strips of plastic packets,
okay,
and
yeah.
so they're all perforated, so you
Sealed.
can like rip off your next
yeah,
dose, and then you
yeah.
have like your 8 a.m. 8 a.m. meds in that little packet, and then you can dump the pills on your hand and take them, and then you go back to your meds, and then the next packet is your noon meds or your 8 whatever, and it's all custom.
Depends, yeah.
It's all
so
customized,
cool.
yeah.
Oh, that's great.
I don't think the big box places that I've been to even offer something like that.
No, and
So
the ones that
huge.
do, they're shipping them from some
place.
destination. So the big problem people have with those services is,
You get
let's say there's a
changed.
medication change.
Yeah, I was just gonna say that.
Sure.
They make you wait until the next cycle starts, which could be up to 30 days
Right.
for the medication.
And that can be
change to
serious,
happen.
That can
especially
be a
for like
problem.
mental health things and stuff like
Right,
that.
and they're also not tracking down doctors to make sure you have refills and make sure that what you're sending is the actual regimen that they're supposed to be on, right? Like,
Yes.
we're actually making sure that what we send out is what the patient's supposed to be on. A lot of these other ones that are shipping from across the country, whatever orders you have on file,
That's it.
When it's your date to be filled, they're sending the orders, they're shipping it, and if anything comes later, they're going to send it in a separate package. And so it's a little bit, we have that extra level of care
It's very impersonal.
and management,
Right.
right?
Well, I think in general, the further you go out with something, the harder it is to corral it and keep it controlled.
For sure.
And I think that's exactly that. I think so
Yeah.
many times that people fall through the cracks when it comes to changes and things that are going on like that. So,
And it's the people that need the most attention and help that benefit most from the program.
Okay.
Right. So, if you're relatively healthy and you're on a few prescriptions and you don't your medications change very often, then maybe something like that would be a good solution for you.
Right.
But for the majority of our patients that need that service, something like that just doesn't work for them.
Right.
And to answer your other question about community outreach, we historically have done a lot of outreach with having pharmacists visit communities and do speeches.
Oh,
and,
very
and,
cool.
And
Education
coaching,
and-
education, and
oh,
all
very
that. It's been
cool.
a challenge with COVID in the last year.
Sure. Yeah.
Nobody wants
Changes
us to do
everything.
Especially
that.
since I would think some of the assisted living and residents like
Yeah.
that would have been great people to educate on
Right.
medication habits and things.
But how can you get in there and
couldn't even
talk with
get
them?
in
Right.
on them. I mean,
Public
Right.
gatherings are just not a
Right.
thing right
Yeah.
now. So it's
Right.
we've had to hunker down a little bit and just take care of patients in the pharmacy, which we're fine with too.
Yeah. Hopefully, we'll get to that point again that those good things can happen.
Yeah,
like that.
absolutely.
So,
That's
build
kind
on
of
that.
it's on the horizon, I think.
Excellent.
Yeah.
Excellent. So, fantastic. I think this information is really, really important.
Yeah.
I think bottom line is people, if they can think of local, they can also think local pharmacy.
Mm-hmm.
And I just love that. It's great to work with you through RelyLocal in general. And then the fact that you're helping people with all these extra things that are available and bringing them to bettering their medicine world, so to speak, and I think that's fantastic. So,
Absolutely.
Yeah. Any other questions, Becca? Did you have anything?
I mean, I just maybe one little follow-up, like besides the obvious, personal touch and things like that, what is the biggest benefit of going to a local family-owned pharmacy?
Yeah, I think we've covered a lot of it, but I think to kind of summarize, it's customized care. So everybody needs something different from their pharmacy and from their pharmacist. And so you're able to come into our pharmacy, explain your needs, and we're going to provide and do whatever we can to meet those needs. So if that means delivery, if that means delivery between 2 p.m. and 4 p.m.,
wow.
If that means delivery, but you got to go to the back, but don't wake up the baby, and, that sort of thing. If that means the medication packaging,
yes.
If that means researching a Part D plan to help you pick a plan that best suits your needs,
very cool,
and is going to save you a bunch of money.
Sure.
If that means looking at if paying out of pocket might be better than using your insurance to save you some money.
Interesting.
If that means researching manufacturer discounts for you because you don't have the internet or you don't know how to do it yourself. To save some money.
That's cool.
So we're really here for people. People come to us and they tell us what they need. We meet them in that place.
Good.
And then we do our best to meet their needs.
Oh, that's bottom line. You just said it. You could almost end right there.
Yeah.
Needs.
Right.
Yeah.
Because I think the big box just is not able to meet people's needs. I don't think from the many things that we were just talking about here a little bit, it doesn't seem like the functionality is the same. The connection isn't the same.
Right.
Being local.
Yeah, I think pharmaceuticals in general is a commodity. If you can go to any pharmacy and get a similar product, maybe the inactive ingredients are slightly different, but in general, it's a commodity.
Right.
If you're looking to just go get a commodity, you don't need anything else from your experience. Maybe that is what is okay with you.
Right.
But if you're looking to save some time or save some money, or get advice or be able to spend time with the pharmacist, I think independent pharmacy might be a better choice for you.
Well, let's hope so. Thank you so much, Alex, for talking with us today.
Happy
this information, this is fantastic. We'd love to have you back, maybe updating on different things or just other things that are going on within your business or that the community could learn from would be fantastic. We
Absolutely.
would love that.
I'll come back anytime. This was a pleasure. Thanks for having me.
We really enjoyed it. So thank you, everybody, for joining us here on Rely on Local. And please subscribe. Please tell your friends. And please join us next time when we have somebody else super exciting, just like Alex here today. Thank you for joining us today.